Hello, nursing students. Welcome to Nursing Exam Preparation, your trusted resource for mastering nursing exams with confidence. In today's video, we'll be walking you through 150 multiple-choice questions, MCQs, on stroke, each one carefully crafted to challenge your knowledge and deepen your understanding of this critical topic. Following each question, we provide detailed explanations to help you not only choose the correct answer, but also understand the reasoning behind it. Whether you're just starting your studies or reviewing for exams, this video is designed to test your skills, enhance your critical thinking, and strengthen key concepts in stroke nursing care. Be sure to like this video, share it with your classmates, and subscribe to Nursing Exam Preparation for more valuable content. Don't forget to hit the bell icon to stay updated on our latest videos, all designed to help you succeed. After watching, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work together toward mastering stroke care and achieving exam success. 1. Which of the following is a common risk factor for ischemic stroke? A. Hypotension. B. Hypertension. C. Low cholesterol. D. Low blood sugar. Answer: B. Hypertension. Rationale: hypertension is one of the most significant risk factors for ischemic stroke. It causes damage to blood vessels, which can lead to clot formation and block blood flow to the brain. Hypotension, low cholesterol, and low blood sugar are not direct risk factors for ischemic stroke. 2. A patient presents with sudden onset of speech difficulty and right-sided weakness. Which diagnostic test should be performed first? 8. Carotid ultrasound. B. MRI of the brain. C. CT scan of the brain. D. ECG. Answer: C. CT scan of the brain. Rationale: a CT scan of the brain is the first diagnostic test to perform in the acute setting of a suspected stroke. It helps differentiate between ischemic and hemorrhagic stroke, which is critical for determining the appropriate treatment. MRI may take longer and is not ideal in the acute phase. Carotid ultrasound and ECG are useful later, but not first-line tests. 3. Which of the following is characteristic of a hemorrhagic stroke? A. Clot formation blocking a cerebral artery. B. Bleeding within the brain tissue. C. Narrowing of the carotid artery. D. Fat embolism in the brain. Answer: B. Bleeding within the brain tissue. Rationale: hemorrhagic stroke is caused by bleeding within the brain due to the rupture of a blood vessel. Ischemic stroke, in contrast, is caused by a clot blocking a cerebral artery. Carotid artery narrowing and fat embolism are not the primary causes of hemorrhagic stroke. 4. Which of the following is a key clinical manifestation of a stroke? A. Chest pain. B. Nausea and vomiting. C. Sudden confusion or trouble speaking. D. Back pain. Answer: C. Sudden confusion or trouble speaking. Rationale: sudden confusion, trouble speaking, or understanding speech is a hallmark symptom of a stroke. Chest pain and back pain are not typically associated with strokes, but may occur in other conditions. Nausea and vomiting can occur in some strokes, but they are not primary symptoms. 5. In the management of acute ischemic stroke, which of the following medications is commonly used to dissolve the clot? A. Warfarin. B. Thrombolytics, e.g., TPA. C. Aspirin. D. Heparin. Answer: B. Thrombolytics, e.g., TPA. Rationale: thrombolytics, such as tissue plasminogen activator, TPA, are used in acute ischemic stroke to dissolve the clot and restore blood flow to the brain. Warfarin, aspirin, and heparin are anticoagulants, but are not used acutely to dissolve clots in ischemic stroke. 6. A stroke patient is receiving rehabilitation therapy. Which of the following should the nurse prioritize in the early stages of recovery? A. Promoting deep breathing exercises. B. Assessing for swallowing difficulties. C. Encouraging independent mobility. D. Focusing on cognitive rehabilitation. Answer: B. Assessing for swallowing difficulties. Rationale: swallowing difficulties are common in the early stages of stroke recovery and can lead to aspiration and pneumonia if not managed appropriately. Deep breathing, mobility, and cognitive rehabilitation are also important, but the immediate concern is ensuring safe swallowing. 7. Which of the following best describes the pathophysiology of ischemic stroke? A. Rupture of a cerebral artery causing bleeding in the brain. B. Blockage of blood flow due to a clot or embolism. C. Inflammation of the brain tissue due to infection. D. Narrowing of blood vessels in the neck. Answer: B. Blockage of blood flow due to a clot or embolism. Rationale: ischemic stroke is caused by a blockage in a cerebral artery due to a clot, thrombosis, or an embolism that travels to the brain. Hemorrhagic stroke involves bleeding, while inflammation or narrowing of arteries is not the direct cause of ischemic stroke. 8. Which of the following is a long-term complication of stroke? A. Asthma. B. Permanent disability. C. Gastritis. D. Rheumatoid arthritis. Answer: B. Permanent disability. Rationale: permanent disability, such as paralysis, speech difficulties, or cognitive impairment, is a common long-term complication of stroke, especially if the stroke is severe or untreated. Asthma, gastritis, and rheumatoid arthritis are unrelated to stroke complications. 9. Which of the following factors can significantly increase the risk of stroke recurrence? A. Taking daily aspirin. B. Controlling blood pressure. C. Smoking. D. Increasing physical activity. Answer: C. Smoking. Rationale: smoking is a major modifiable risk factor for stroke recurrence because it contributes to the development of atherosclerosis and blood clot formation. While daily aspirin, blood pressure control, and physical activity help reduce stroke risk, smoking has the opposite effect. 10. A nurse is educating a patient on the importance of controlling blood pressure to reduce stroke risk. Which blood pressure reading indicates the patient is at increased risk for stroke? A. 120/80 mmHg. B. 130/85 mmHg. C. 160/100 mmHg. D. 140/90 mmHg. Answer: C. 160/100 mmHg. Rationale: a blood pressure of 160/100 mmHg is considered hypertensive and increases the risk of stroke. Ideal blood pressure is around 120/80 mmHg, while 130/85 mmHg and 140/90 mmHg indicate elevated blood pressure. The risk is greatest at the higher level of 160/100 mmHg. 11. Which of the following is a typical cause of an ischemic stroke? A. Hemorrhage in the brain. B. A clot obstructing a cerebral artery. C. Aneurysm rupture. D. Inflammation of brain tissue. Answer: B. A clot obstructing a cerebral artery. Rationale: ischemic strokes are caused by a blockage, usually a clot or embolism, obstructing a cerebral artery, leading to a reduction in blood flow. Hemorrhage, aneurysm rupture, and inflammation are causes of hemorrhagic stroke, not ischemic stroke. 12. What is the primary action of tissue plasminogen activator, TPA, in the treatment of ischemic stroke? A. To decrease intracranial pressure. B. To prevent further clot formation. C. To dissolve the clot and restore blood flow. D. To stabilize blood pressure. Answer: C. To dissolve the clot and restore blood flow. Rationale: TPA is a thrombolytic medication that works by dissolving clots, restoring blood flow to the brain in cases of ischemic stroke. It does not directly address intracranial pressure, clot prevention, or blood pressure stabilization. 13. A patient with stroke has a blood pressure reading of 180/110 mmHg. What is the most appropriate immediate intervention? A. Administer a thrombolytic agent. B. Administer an antihypertensive medication. C. Begin deep breathing exercises. D. Increase fluid intake. Answer: B. Administer an antihypertensive medication. Rationale: high blood pressure is common during a stroke, but needs to be managed to reduce the risk of hemorrhagic conversion and other complications. Antihypertensive medication is indicated to bring the blood pressure down to a safer level. Thrombolytics are contraindicated in high blood pressure situations. 14. Which symptom would be indicative of a stroke affecting the right hemisphere of the brain? A. Left-sided weakness or paralysis. B. Difficulty speaking or understanding language. C. Loss of vision in one eye. D. Loss of coordination and balance. Answer: A. Left-sided weakness or paralysis. Rationale: a stroke affecting the right hemisphere typically results in left-sided weakness or paralysis, as the brain's motor control centers are contralateral. Difficulty speaking or understanding language occurs with left hemisphere strokes, and balance issues can occur with strokes in either hemisphere. 15. A patient is experiencing a transient ischemic attack, TA. What is the most appropriate action for the nurse to take? A. Administer aspirin and observe the patient. B. Prepare for surgical intervention. C. Administer thrombolytics immediately. D. Monitor for signs of a stroke and notify the healthcare provider. Answer: D. Monitor for signs of a stroke and notify the healthcare provider. Rationale: a TIA is a temporary blockage that resolves within 24 hours. Although it does not cause permanent damage, it signals a high risk for future stroke, and prompt monitoring and medical intervention are required. Aspirin may be prescribed later, but surgery or thrombolytics are not indicated. 16. Which of the following is a modifiable risk factor for stroke? A. Age. B. Gender. C. Smoking. D. Family history. Answer: C. Smoking. Rationale: smoking is a modifiable risk factor for stroke because it contributes to the development of atherosclerosis and clot formation. Age, gender, and family history are non-modifiable risk factors. 17. In which situation is the use of thrombolytics, TPA, contraindicated? A. Ischemic stroke occurring within 3 hours of symptom onset. B. A patient with a known history of uncontrolled hypertension. C. A patient with a previous stroke. D. A patient who has been on aspirin therapy. Answer: B. A patient with a known history of uncontrolled hypertension. Rationale: thrombolytics are contraindicated in patients with uncontrolled hypertension because they can increase the risk of hemorrhagic transformation. TPA is used for ischemic stroke within 3 hours of symptom onset, but blood pressure must be controlled. 18. What is the first step in the management of a stroke patient in the emergency department? A. Administer oxygen. B. Perform a CT scan of the brain. C. Start 4 fluids. D. Administer aspirin. Answer: B. Perform a CT scan of the brain. Rationale: the first step in stroke management is a CT scan to differentiate between ischemic and hemorrhagic stroke, as the treatment options differ. Oxygen, 4 fluids, and aspirin may be part of the treatment plan, but a CT scan is the priority. 19. Which of the following is a common long-term complication of stroke? A. Increased blood sugar levels. B. Chronic headaches. C. Cognitive impairment and memory loss. D. Peripheral edema. Answer: C. Cognitive impairment and memory loss. Rationale: cognitive impairment, including memory loss, is a common long-term complication of stroke due to damage in the brain's cognitive centers. Increased blood sugar, headaches, and peripheral edema are not typically long-term stroke complications. 20. The nurse is teaching a patient about stroke prevention. Which statement by the patient indicates the need for further teaching? A. I will stop smoking. B. I will control my blood pressure. C. I will eat more salt to increase my blood pressure. D. I will take my prescribed anticoagulants as directed. Answer: C. I will eat more salt to increase my blood pressure. Rationale: eating more salt can increase blood pressure, which is a modifiable risk factor for stroke. Controlling blood pressure, stopping smoking, and adhering to anticoagulant therapy are appropriate strategies for stroke prevention. 21. Which of the following is an early sign of a hemorrhagic stroke? A. Severe headache. B. Facial drooping. C. Loss of sensation on one side. D. Slurred speech. Answer: A. Severe headache. Rationale: a severe headache, often described as the worst headache of life, is an early sign of a hemorrhagic stroke. Facial drooping, loss of sensation, and slurred speech are more commonly seen in ischemic strokes. 22. Which of the following diagnostic tests is most useful for determining the cause of a hemorrhagic stroke? A. Electrocardiogram, ECG. B. Carotid ultrasound. C. CT scan of the brain. D. MRI of the brain. Answer: C. CT scan of the brain. Rationale: A CT scan is the most common and effective test to quickly identify bleeding in the brain during a hemorrhagic stroke. MRI can also be useful, but is not typically used in the acute phase. An ECG and carotid ultrasound are not useful for determining hemorrhagic stroke causes. 23. A patient is receiving thrombolytic therapy for an ischemic stroke. Which of the following would be a priority for the nurse to monitor? A. Heart rate. B. Oxygen saturation.
C. Bleeding.
D. Urine output. Answer: C. Bleeding. Rationale: thrombolytic therapy increases the risk of bleeding, so it is crucial for the nurse to monitor for any signs of hemorrhage. While heart rate, oxygen saturation, and urine output are important, bleeding is the primary concern with thrombolytics. 24. What is the goal of acute stroke treatment with thrombolytic therapy? A. To increase blood pressure. B. To prevent the spread of the clot. C. To remove the clot and restore blood flow to the brain. D. To decrease intracranial pressure. Answer: C. To remove the clot and restore blood flow to the brain. Rationale: the goal of thrombolytic therapy in acute ischemic stroke is to dissolve the clot that is obstructing blood flow to the brain, thereby restoring perfusion and minimizing brain damage. 25. A nurse is caring for a patient who is recovering from a stroke. Which of the following interventions is most important for preventing aspiration? A. Place the patient in a lateral position. B. Administer thickened liquids. C. Encourage the patient to talk while eating. D. Provide small, frequent meals. Answer: B. Administer thickened liquids. Rationale: thickened liquids reduce the risk of aspiration by making swallowing easier and safer for stroke patients with dysphagia. The lateral position, small meals, and encouraging speech while eating may not be sufficient to prevent aspiration. 26. The nurse is assessing a patient for signs of a stroke. Which of the following should prompt the nurse to suspect a stroke? A. Numbness and tingling in the left hand. B. A sudden inability to speak or understand speech. C. Blurred vision after exertion. D. Unilateral weakness and dizziness after exercise. Answer: B. A sudden inability to speak or understand speech. Rationale: a sudden inability to speak or understand speech is a classic sign of stroke. Numbness, tingling, blurred vision, and dizziness could be symptoms of other conditions, but are not specific to stroke. 27. Which of the following is the most common type of stroke? A. Hemorrhagic stroke. B. Ischemic stroke. C. Transient ischemic attack. D. Cryptogenic stroke. Answer: B. Ischemic stroke. Rationale: ischemic strokes are the most common type, accounting for about 80% of all strokes. Hemorrhagic strokes, TIAs, and cryptogenic strokes are less common. 28. Which of the following is the most significant risk factor for a stroke in a patient with atrial fibrillation? A. Hyperlipidemia. B. Hypertension. C. Smoking. D. Blood clots in the heart. Answer: D. Blood clots in the heart. Rationale: blood clots forming in the heart due to atrial fibrillation are the most significant risk factor for stroke in these patients. Hypertension, hyperlipidemia, and smoking are other risk factors, but do not directly relate to the clot formation in atrial fibrillation. 29. A nurse is educating a patient on signs of stroke. Which of the following should be included in the teaching? A. Sudden headache and difficulty walking. B. Sudden loss of appetite and dizziness. C. Sudden pain in the chest and left arm. D. Sudden numbness in the feet and legs. Answer: A. Sudden headache and difficulty walking. Rationale: a sudden headache, difficulty walking, and other neurological changes are signs of a stroke. Chest pain and arm pain are signs of a heart attack, while numbness in the feet and legs is not specific to stroke. 30. A patient with stroke is at risk for developing a deep vein thrombosis, DVT. Which of the following interventions is most appropriate? A. Apply heat to the legs. B. Administer anticoagulants. C. Encourage prolonged bed rest. D. Place the patient in a high Fowler's position. Answer: B. Administer anticoagulants. Rationale: anticoagulants can prevent the formation of blood clots in stroke patients, reducing the risk of DVT. Heat, prolonged bed rest, and high Fowler's position are not appropriate interventions for preventing DVT. 31. What is the primary cause of an ischemic stroke? A. Aneurysm rupture. B. Blood clot or embolism blocking a blood vessel. C. Chronic hypertension. D. Infection causing inflammation in the brain. Answer: B. Blood clot or embolism blocking a blood vessel. Rationale: ischemic stroke is caused by a blockage in the brain's blood vessels, typically due to a blood clot, thrombosis, or an embolism. Aneurysm rupture and infection are causes of hemorrhagic stroke, not ischemic stroke. 32. Which of the following would be an appropriate primary prevention strategy for reducing stroke risk? A. Administering TPA to all high-risk patients. B. Encouraging smoking cessation. C. Restricting fluid intake in patients with hypertension. D. Providing sedatives to patients with anxiety. Answer: B. Encouraging smoking cessation. Rationale: smoking cessation is a primary prevention strategy for reducing stroke risk. Smoking contributes to atherosclerosis and clot formation. TPA is used for acute treatment, and fluid restriction or sedatives are not relevant to primary stroke prevention. 33. A patient presents with sudden loss of vision in one eye. This is most likely indicative of which condition? A. Hemorrhagic stroke. B. Ischemic stroke affecting the occipital lobe. C. Transient ischemic attack, TIA. D. Diabetic retinopathy. Answer: C. Transient ischemic attack, TIA. Rationale: sudden vision loss in one eye is a common symptom of a TIA, which is often a precursor to a full stroke. TIAs are temporary and typically resolve within 24 hours. Hemorrhagic and ischemic strokes can affect vision, but the transient nature of vision loss points to TIA. 34. The nurse is caring for a patient who has had a stroke. Which of the following is most important when positioning the patient in bed? A. Keep the head of the bed flat. B. Position the patient on their affected side. C. Elevate the head of the bed to 30 degrees. D. Position the patient in a high Fowler's position. Answer: C. Elevate the head of the bed to 30 degrees. Rationale: elevating the head of the bed to 30 degrees helps prevent aspiration and promote circulation. Positioning the patient on the affected side is not recommended as it may impede respiratory function, and high Fowler's position is typically reserved for patients with respiratory distress. 35. A nurse is assessing a patient who is at high risk for stroke. Which of the following is the most important risk factor to address first? A. Smoking. B. Family history of stroke. C. Hyperlipidemia. D. Sedentary lifestyle. Answer: A. Smoking. Rationale: smoking is a major modifiable risk factor for stroke. It contributes to the development of atherosclerosis and increases clot formation. While family history, hyperlipidemia, and a sedentary lifestyle are also risk factors, smoking is the most urgent to address. 36. Which of the following is a potential complication of a hemorrhagic stroke? A. Increased blood pressure. B. Seizures. C. Deep vein thrombosis, DVT. D. Acute kidney injury. Answer: B. Seizures. Rationale: seizures can be a complication of hemorrhagic stroke due to the irritation and damage caused by blood in the brain. Increased blood pressure is often a result of hemorrhagic stroke, but not a complication. DVT and acute kidney injury are not directly associated with hemorrhagic stroke. 37. A patient with a history of stroke asks the nurse how to reduce their risk of another stroke. Which of the following should the nurse recommend? A. Decrease physical activity to prevent strain. B. Control blood pressure and cholesterol levels. C. Consume a high-fat, low-protein diet. D. Take aspirin and avoid blood pressure medications. Answer: B. Control blood pressure and cholesterol levels. Rationale: controlling blood pressure and cholesterol levels is essential in preventing another stroke. Physical activity should be encouraged to maintain health, and a low-fat, high-protein diet is recommended. Aspirin is sometimes prescribed, but blood pressure medications are also important for stroke prevention. 38. A nurse is educating a patient about the warning signs of stroke. Which of the following would the nurse include in the teaching? A. Sudden pain in the chest. B. Sudden weakness or numbness in the face, arm, or leg. C. Sudden loss of appetite. D. Sudden bloating or abdominal pain. Answer: B. Sudden weakness or numbness in the face, arm, or leg. Rationale: sudden weakness or numbness, particularly on one side of the body, is a hallmark symptom of a stroke. Chest pain is indicative of a heart attack, while loss of appetite and abdominal pain are unrelated to stroke symptoms. 39. In which scenario would thrombolytic therapy, TPA, be contraindicated? A. Stroke onset occurred 2 hours ago. B. The patient has a history of gastrointestinal bleeding. C. The patient has a blood pressure of 150/90 mmHg. D. The patient is on anticoagulant therapy. Answer: B. The patient has a history of gastrointestinal bleeding. Rationale: thrombolytic therapy is contraindicated in patients with a history of gastrointestinal bleeding or other active bleeding disorders. A history of anticoagulant therapy or a blood pressure of 150/90 mmHg may require careful management, but are not absolute contraindications. 40. Which of the following should be included in the discharge teaching for a patient recovering from a stroke? A. Encourage a sedentary lifestyle to prevent further strokes. B. Stop taking blood pressure medications if feeling better. C. Maintain a healthy diet, low in sodium and fat. D. Resume driving immediately if cleared by the healthcare provider. Answer: C. Maintain a healthy diet, low in sodium and fat. Rationale: a healthy diet, low in sodium and fat, is crucial for stroke recovery and prevention. A sedentary lifestyle, discontinuing medications without consultation, and resuming driving without clearance are not recommended in the immediate recovery phase. 41. What is a primary nursing intervention for a patient with a stroke and dysphagia? A. Administer a regular diet. B. Encourage the patient to speak during meals. C. Assess for swallowing difficulties and provide thickened liquids. D. Position the patient in a high Fowler's position at all times. Answer: C. Assess for swallowing difficulties and provide thickened liquids. Rationale: assessing for dysphagia and providing thickened liquids are essential to preventing aspiration and ensuring safe swallowing. A regular diet and encouraging speech during meals could increase the risk of aspiration. High Fowler's position is appropriate, but not always necessary. 42. Which of the following is an expected finding in a patient who has had a stroke affecting the left hemisphere of the brain? A. Left-sided weakness or paralysis. B. Difficulty with speech and language. C. Loss of vision in one eye. D. Sudden difficulty with balance. Answer: B. Difficulty with speech and language. Rationale: the left hemisphere controls speech and language. A stroke in this area commonly results in aphasia, difficulty speaking or understanding language. Left-sided weakness is associated with right hemisphere strokes, and balance problems typically arise from cerebellar involvement. 43. A patient is receiving rehabilitation following a stroke. Which of the following should the nurse prioritize to help the patient regain independence? A. Encouraging early ambulation. B. Focusing on long-term cognitive rehabilitation. C. Providing passive range of motion exercises only. D. Promoting self-care and mobility skills. Answer: D. Promoting self-care and mobility skills. Rationale: stroke rehabilitation focuses on regaining independence, which includes promoting self-care and mobility. While early ambulation and passive range of motion exercises are important, the primary goal is helping the patient regain functional independence. 44. A patient with a history of ischemic stroke is at risk for recurrent strokes. Which of the following interventions is most important to prevent stroke recurrence? A. Administering aspirin regularly. B. Limiting fluid intake. C. Encouraging a high-fat diet. D. Restricting physical activity. Answer: A. Administering aspirin regularly. Rationale: aspirin is commonly prescribed to reduce the risk of recurrent ischemic strokes by preventing clot formation. Limiting fluid intake, a high-fat diet, and restricting physical activity are not recommended for stroke prevention. 45. What is the most important intervention during the acute phase of a stroke? A. Monitor for respiratory distress. B. Administer thrombolytic therapy within the therapeutic window. C. Encourage verbal communication. D. Initiate rehabilitation therapy immediately. Answer: B. Administer thrombolytic therapy within the therapeutic window. Rationale: the most critical intervention during the acute phase of ischemic stroke is administering thrombolytic therapy, TPA, within the first 3 hours to dissolve the clot. Respiratory distress and communication issues should also be addressed, but are secondary to thrombolytic therapy. 46. Which of the following diagnostic tests would be most useful in identifying a carotid artery blockage that could lead to a stroke? A. Electroencephalogram, EEG. B. Carotid ultrasound. C. MRI of the brain. D. Chest X-ray. Answer: B. Carotid ultrasound. Rationale: a carotid ultrasound is the most effective diagnostic tool for identifying blockages or narrowing in the carotid arteries, which are a common source of embolic strokes. EEG, MRI, and chest X-ray are not typically used for diagnosing carotid artery disease. 47. A patient with a history of stroke is experiencing new onset of confusion and weakness. What should the nurse do first? A. Administer a sedative to calm the patient. B. Assess the patient's blood glucose level. C. Call a rapid response team and assess for new stroke symptoms. D. Increase the patient's fluid intake. Answer: C. Call a rapid response team and assess for new stroke symptoms. Rationale: new confusion and weakness could be signs of a recurrent stroke, and immediate assessment is critical. Calling the rapid response team is appropriate to ensure timely intervention. Blood glucose, fluids, and sedatives may be necessary, but stroke symptoms must be ruled out first. 48. The nurse is educating a patient on the importance of controlling blood pressure to prevent stroke. Which of the following statements by the patient indicates a need for further education? A. I will monitor my blood pressure daily. B. I will reduce my salt intake to help lower my blood pressure. C. I will stop taking my blood pressure medication if I feel fine. D. I will exercise regularly to help control my blood pressure. Answer: C. I will stop taking my blood pressure medication if I feel fine. Rationale: stopping blood pressure medication without medical advice can increase the risk of stroke. Regular monitoring, salt reduction, and exercise are important components of blood pressure management. 49. A patient is at high risk for stroke. Which of the following should be prioritized to reduce stroke risk? A. Smoking cessation. B. Performing daily exercise. C. Limiting alcohol consumption. D. Starting an aspirin regimen. Answer: A. Smoking cessation. Rationale: smoking cessation is the most effective modifiable risk factor to reduce stroke risk. Exercise, alcohol moderation, and aspirin therapy are also important, but do not have the same direct impact as quitting smoking. 50. A stroke patient is demonstrating signs of dysphagia. What is the nurse's priority intervention? A. Begin oral feeding with a soft diet. B. Initiate a swallow study and provide thickened liquids. C. Position the patient on their unaffected side. D. Encourage the patient to eat slowly. Answer: B. Initiate a swallow study and provide thickened liquids. Rationale: a swallow study is necessary to assess the patient's swallowing function and determine safe feeding strategies. Thickened liquids reduce the risk of aspiration. Oral feeding with a soft diet and positioning are secondary interventions. 51. A patient who has recently had a stroke is being discharged. Which of the following instructions should the nurse include to reduce the risk of a recurrent stroke? A. Avoid taking medications prescribed for high blood pressure. B. Discontinue physical activity until fully recovered. C. Take prescribed anticoagulant medications as directed. D. Increase dietary sodium intake. Answer: C. Take prescribed anticoagulant medications as directed. Rationale: anticoagulants are often prescribed to prevent blood clots, which can reduce the risk of recurrent strokes. Discontinuing medications or avoiding physical activity can increase stroke risk. A high-sodium diet is not recommended. 52. A patient has been diagnosed with a hemorrhagic stroke. What is the most important priority in the management of this patient? A. Administering thrombolytic therapy. B. Preventing further bleeding by controlling blood pressure. C. Encouraging early mobilization. D. Initiating rehabilitation therapy. Answer: B. It's preventing further bleeding by controlling blood pressure. Rationale: in hemorrhagic stroke, the primary focus is to prevent further bleeding by controlling blood pressure. Thrombolytic therapy is contraindicated, and rehabilitation should be delayed until the acute phase is managed. 53. A patient presents to the emergency department with sudden onset of speech difficulties, right-sided weakness, and facial drooping. What is the priority nursing intervention? A. Administer oxygen. B. Assess the patient's NIH stroke scale, NIHSS score. C. Prepare the patient for surgery. D. Encourage the patient to speak. Answer: B. Assess the patient's NIH stroke scale, NIHSS score. Rationale: the NIHSS is used to assess the severity of stroke symptoms and helps guide treatment decisions, including whether thrombolytic therapy is appropriate. Administering oxygen is important, but secondary to stroke assessment. 54. A patient is undergoing a carotid endarterectomy. What is the primary goal of this surgery in stroke prevention? A. To prevent the formation of emboli. B. To control blood pressure in the carotid arteries. C. To remove plaque from the carotid arteries. D. To prevent hemorrhagic strokes. Answer: C. To remove plaque from the carotid arteries. Rationale: carotid endarterectomy is performed to remove plaque from the carotid arteries, which can reduce the risk of ischemic stroke by improving blood flow to the brain. The other options do not address the primary goal of the surgery. 55. The nurse is educating a stroke patient on medication management. Which statement by the patient indicates an understanding of anticoagulant therapy? A. I will avoid taking aspirin while on anticoagulants. B. I will take the anticoagulant as soon as I remember, even if it's late. C. I need to take the medication exactly as prescribed to prevent another stroke. D. I can stop taking the anticoagulant once I feel better. Answer: C. I need to take the medication exactly as prescribed to prevent another stroke. Rationale: it's essential that the patient takes anticoagulants as prescribed to reduce the risk of stroke. Aspirin should be avoided unless prescribed. Missed doses should be handled as directed by the healthcare provider, and the medication should not be stopped prematurely. 56. Which of the following findings is most consistent with a right-sided ischemic stroke? A. Right-sided weakness and difficulty with speech. B. Left-sided weakness and inability to recognize familiar objects. C. Loss of sensation on the right side of the body. D. Left-sided weakness and confusion. Answer: B. Left-sided weakness and inability to recognize familiar objects. Rationale: a right-sided stroke typically affects the left side of the body and can cause difficulty recognizing familiar objects, agnosia. Speech difficulties and right-sided weakness would be expected with a left-sided stroke. 57. A patient recovering from a stroke is unable to recall the names of their family members. What type of impairment is this? A. Apraxia. B. Dysphagia. C. Agnosia. D. Aphasia. Answer: C. Agnosia. Rationale: agnosia is the inability to recognize familiar objects or people. Apraxia refers to the inability to perform purposeful movements. Dysphagia refers to difficulty swallowing, and aphasia refers to a language disorder affecting speech and understanding. 58. A patient presents with slurred speech, difficulty walking, and facial drooping. Which of the following is the priority action? A. Administer aspirin. B. Call a stroke code or rapid response. C. Position the patient in a high Fowler's position. D. Encourage the patient to rest. Answer: B. Call a stroke code or rapid response. Rationale: sudden onset of these symptoms indicates a possible stroke and immediate action is necessary. A stroke code or rapid response team should be activated. Aspirin and positioning can be done later after the stroke is confirmed. 59. Which of the following laboratory values is important to monitor when a patient is receiving thrombolytic therapy? A. Blood glucose level. B. Hemoglobin level. C. Prothrombin time, PT, or International Normalized Ratio, INR. D. White blood cell count. Answer: C. Prothrombin time, PT, or International Normalized Ratio, INR. Rationale: PT and INR are important to monitor during thrombolytic therapy to assess the patient's risk for bleeding. Blood glucose, hemoglobin, and white blood cell count are important but not as directly related to thrombolytic therapy. 60. A nurse is teaching a patient about the risk of stroke. Which of the following is a modifiable risk factor that the nurse should emphasize? A. Family history of stroke. B. Age. C. Physical inactivity. D. Gender. Answer: C. Physical inactivity. Rationale: physical inactivity is a modifiable risk factor for stroke. Family history, age, and gender are non-modifiable risk factors. Encouraging physical activity can reduce stroke risk. 61. A patient with a history of stroke asks the nurse about controlling high blood pressure. Which of the following lifestyle changes should the nurse recommend? A. Eating a high-sodium, high-fat diet. B. Limiting physical activity to reduce stress. C. Reducing sodium intake and engaging in regular physical activity. D. Decreasing fluid intake to reduce blood volume. Answer: C. Reducing sodium intake and engaging in regular physical activity. Rationale: reducing sodium and engaging in regular physical activity are effective strategies for controlling blood pressure and reducing stroke risk. A high-sodium, high-fat diet and limiting physical activity are not recommended. 62. A patient who had a stroke is receiving rehabilitation. Which of the following goals is the priority in the early phase of rehabilitation? A. Encourage the patient to walk independently. B. Promote self-care and basic mobility skills. C. Focus on regaining cognitive function. D. Ensure full recovery of speech. Answer: B. Promote self-care and basic mobility skills. Rationale: in the early phase of rehabilitation, the focus is on promoting self-care and mobility skills, which are critical for independence. Cognitive and speech recovery are important, but come after mobility and basic self-care. 63. Which of the following is a primary reason that patients with a hemorrhagic stroke are at risk for increased intracranial pressure, ICP? A. Blood accumulation in the brain increases pressure. B. Decreased blood flow to the brain causes swelling. C. Fluid retention due to dehydration increases pressure. D. Vasodilation from medications increases ICP. Answer: A. Blood accumulation in the brain increases pressure. Rationale: in hemorrhagic stroke, bleeding into the brain leads to blood accumulation, which increases intracranial pressure. The other options do not directly contribute to ICP in hemorrhagic stroke. 64. A patient with a history of stroke is at risk for falls. Which of the following interventions should the nurse implement to reduce fall risk? A. Place the patient in restraints to prevent injury. B. Instruct the patient to avoid moving independently. C. Provide a non-slip environment and assist with ambulation. D. Encourage the patient to remain in bed for safety. Answer: C. Provide a non-slip environment and assist with ambulation. Rationale: a non-slip environment and assistance with ambulation can help reduce fall risk in stroke patients. Restraints, avoiding movement, and remaining in bed all increase the risk of complications and decrease mobility. 65. A patient is receiving thrombolytic therapy for an ischemic stroke. Which of the following interventions is a priority during therapy? A. Monitor vital signs for signs of bleeding. B. Encourage oral hydration. C. Initiate rehabilitation therapy. D. Restrict the patient's fluid intake. Answer: A. Monitor vital signs for signs of bleeding. Rationale: the priority during thrombolytic therapy is monitoring for signs of bleeding, as this therapy can increase the risk of hemorrhage. Oral hydration and rehabilitation therapy should be initiated after the acute phase. 66. A nurse is assessing a patient with a history of stroke. Which of the following findings should be reported immediately? A. Decreased appetite and fatigue. B. Sudden difficulty speaking and right-sided weakness. C. Mild headache and dizziness. D. Increased interest in physical therapy. Answer: B. Sudden difficulty speaking and right-sided weakness. Rationale: sudden difficulty speaking and right-sided weakness are signs of a potential recurrent stroke or complications from the initial stroke and should be reported immediately. Other findings are less urgent. 67. A patient is receiving a fibrinolytic agent for an ischemic stroke. Which of the following is a contraindication to fibrinolytic therapy? A. Stroke onset more than 4.5 hours ago. B. Recent surgery within the past year. C. Blood pressure of 180 over 100 mmHg. D. History of diabetes. Answer: A. Stroke onset more than 4.5 hours ago. Rationale: fibrinolytic therapy should be given within 4.5 hours of stroke onset. After this time frame, the risk of complications such as bleeding outweighs the benefits. Other conditions may require caution but are not absolute contraindications. 68. A stroke patient is showing signs of dysphagia. What is the nurse's best response? A. Speak more loudly and clearly. B. Allow the patient extra time to speak. C. Encourage the patient to speak more slowly. D. Discontinue verbal communication. Answer: B. Allow the patient extra time to speak. Rationale: allowing the patient extra time to speak is key in supporting a patient with dysphagia. Speaking loudly or slowly may not help and could cause frustration. Communication should continue with patients. 69. A nurse is caring for a patient following a stroke who is experiencing visual disturbances. Which of the following is the most appropriate intervention? A. Provide assistance with ambulation at all times. B. Restrict fluid intake to prevent swelling. C. Arrange for a speech therapy consult. D. Implement fall precautions. Answer: D. Implement fall precautions. Rationale: visual disturbances increase the risk of falls, so fall precautions should be implemented. Assistance with ambulation may also be necessary, but addressing fall risk is the priority. 70. A stroke patient is experiencing difficulty swallowing. What should the nurse do first? A. Place the patient on a clear liquid diet. B. Initiate a swallow study. C. Encourage the patient to eat slowly. D. Begin feeding with pureed foods. Answer: B. Initiate a swallow study. Rationale: a swallow study is necessary to assess the patient's ability to safely swallow and determine appropriate feeding strategies. Initiating a clear liquid diet, encouraging slow eating, or beginning pureed foods without assessment could lead to aspiration. 71. A patient who has had a recent ischemic stroke is being discharged from the hospital. What should the nurse teach the patient to reduce the risk of a recurrent stroke? A. Limit the intake of fruits and vegetables. B. Take prescribed blood pressure medications regularly. C. Avoid physical activity to reduce strain on the heart. D. Stop taking statin medications once cholesterol levels are normal. Answer: B. Take prescribed blood pressure medications regularly. Rationale: hypertension is a major risk factor for stroke, and controlling blood pressure through medication is crucial for preventing recurrence. Limiting fruits and vegetables or avoiding physical activity would increase the risk of stroke. Statins should be continued as prescribed to manage cholesterol. 72. A patient has been diagnosed with a right-sided ischemic stroke. Which of the following signs and symptoms is most likely to be observed? A. Left-sided hemiplegia and difficulty understanding speech. B. Right-sided hemiplegia and difficulty with speech. C. Left-sided hemiplegia and difficulty with vision. D. Right-sided hemiplegia and difficulty with language. Answer: A. Left-sided hemiplegia and difficulty understanding speech. Rationale: a right-sided stroke typically affects the left side of the body and can result in language and comprehension deficits, including difficulty understanding speech, receptive aphasia. The other options are inconsistent with a right-sided stroke. 73. A patient presents with sudden onset of weakness in the right arm, facial drooping on the right side, and difficulty speaking. What is the priority nursing intervention? A. Administer oxygen therapy. B. Assess the patient's Glasgow Coma Scale (GCS) score. C. Notify the stroke team or activate a stroke code. D. Elevate the head of the bed to 45 degrees. Answer: C. Notify the stroke team or activate a stroke code. Rationale: sudden onset of these symptoms suggests a potential stroke, and activating the stroke team immediately is crucial for timely treatment. Oxygen therapy and GCS assessment are important, but the priority is notifying the stroke team. 74. A nurse is caring for a patient post-stroke who has developed dysphagia. What is the best intervention to prevent aspiration pneumonia? A. Place the patient on a pureed diet only. B. Administer antibiotics as prescribed. C. Position the patient in an upright position during meals. D. Restrict fluid intake to minimize risk of choking. Answer. C. Position the patient in an upright position during meals. Rationale. Positioning the patient upright during meals helps reduce the risk of aspiration. Pureed diets may be indicated but should be prescribed after a swallow study. Antibiotics are not used for prevention, and restricting fluids could worsen dehydration. 75. A patient with a history of ischemic stroke is being evaluated for rehabilitation. Which of the following is the most appropriate goal for rehabilitation in the early stages? A. Encourage independence in activities of daily living, ADLs. B. Focus on achieving complete speech recovery. C. Emphasize regaining mobility and strength. D. Increase fluid intake to improve circulation. Answer. C. Emphasize regaining mobility and strength. Rationale. Early rehabilitation focuses on improving mobility and strength to promote independence and prevent complications, such as immobility. Complete speech recovery may take time, and fluid intake is secondary to physical rehabilitation. 76. A patient presents with a suspected stroke. Which of the following is the most important diagnostic test to perform immediately? A. Electrocardiogram, ECG. B. Brain CT, scanned without contrast. C. Carotid ultrasound. D. Chest X-ray. Answer. B. Brain CT scan without contrast. Rationale. A brain CT scan without contrast is the most important test to perform immediately to determine whether the stroke is ischemic or hemorrhagic. This will guide the treatment approach. Other tests are helpful, but not immediate priorities. 77. A nurse is caring for a stroke patient who is receiving thrombolytic therapy. Which of the following is a contraindication for this treatment? A. Blood pressure of 160/90 mmHg. B. History of gastrointestinal bleeding. C. Mild headache and dizziness. D. History of chronic hypertension. Answer. B. History of gastrointestinal bleeding. Rationale. A history of gastrointestinal bleeding is a contraindication for thrombolytic therapy due to the increased risk of hemorrhage. Elevated blood pressure and chronic hypertension require careful monitoring, but they are not absolute contraindications. 78. A stroke patient develops aphasia. Which of the following interventions would be most helpful? A. Encourage the patient to speak louder and more clearly. B. Speak to the patient in simple sentences and allow extra time for response. C. Avoid communication with the patient to reduce frustration. D. Tell the patient to write down their thoughts. Answer. B. Speak to the patient in simple sentences and allow extra time for response. Rationale. Patients with aphasia may have difficulty understanding or expressing language. Speaking simply and allowing extra time reduces frustration and promotes communication. Telling the patient to write may not be effective, and avoiding communication is not recommended. 79. A patient who has suffered a stroke is at risk for deep vein thrombosis, DVT. What is the best intervention to prevent DVT in this patient? A. Encourage the patient to remain immobile in bed. B. Perform passive range of motion exercises as tolerated. C. Apply heat packs to the affected limb. D. Restrict the patient's fluid intake. Answer. B. Perform passive range of motion exercises as tolerated. Rationale. Passive range of motion exercises help improve circulation and prevent DVT in immobilized stroke patients. Remaining immobile, applying heat, or restricting fluids could increase the risk of clot formation. 80. A nurse is caring for a patient who is at risk for a stroke. Which of the following interventions is most effective in preventing an ischemic stroke? A. Administering intravenous thrombolytics. B. Controlling blood pressure and cholesterol levels. C. Performing a carotid endarterectomy. D. Encouraging high-fat, high-sodium diet. Answer. B. Controlling blood pressure and cholesterol levels. Rationale. Controlling blood pressure and cholesterol levels is a key preventive measure for ischemic stroke. Thrombolytics are used for acute treatment, not prevention. Carotid endarterectomy is considered in specific cases, and a high-fat, high-sodium diet increases stroke risk. 81. A patient has a stroke affecting the left hemisphere of the brain. Which of the following symptoms would the nurse expect to observe? A. Left-sided hemiplegia and difficulty understanding speech. B. Right-sided hemiplegia and speech difficulties. C. Left-sided hemiplegia and confusion. D. Right-sided hemiplegia and difficulty recognizing objects. Answer: B. Right-sided hemiplegia and speech difficulties. Rationale: a stroke affecting the left hemisphere usually results in right-sided hemiplegia and language deficits, e.g., aphasia. Other options are inconsistent with left hemisphere involvement. 82. A patient who has had a stroke is showing signs of dysphagia. Which of the following is the priority nursing action? A. Encourage the patient to drink fluids frequently. B. Position the patient in an upright position before eating. C. Administer a soft diet immediately. D. Perform a swallow assessment. Answer: D. Perform a swallow assessment. Rationale: a swallow assessment should be performed to determine the patient's ability to safely swallow before any food or drink is offered. Positioning the patient upright may help, but assessment should come first. 83. A nurse is caring for a patient who has had a stroke and is experiencing neglect of the left side of the body. What intervention should the nurse implement? A. Instruct the patient to focus only on the right side of the body. B. Encourage the patient to perform activities using the left side of the body. C. Place all personal items on the left side to increase awareness. D. Provide a safe environment by restricting mobility. Answer: C. Place all personal items on the left side to increase awareness. Rationale: placing personal items on the neglected side can encourage the patient to become more aware of that side. Encouraging the patient to focus on only the right side or restricting mobility could reinforce neglect. 84. A stroke patient is receiving intravenous thrombolytics. Which of the following is a key assessment before starting therapy? A. Checking the patient's blood glucose level. B. Obtaining a CT scan to rule out hemorrhagic stroke. C. Monitoring the patient's oxygen saturation levels. D. Assessing the patient's fluid balance. Answer: B. Obtaining a CT scan to rule out hemorrhagic stroke. Rationale: a CT scan is necessary to rule out hemorrhagic stroke before starting thrombolytics, as they are contraindicated in hemorrhagic stroke. Other assessments, such as blood glucose, are important but secondary. 85. A stroke patient is being discharged and is prescribed an anticoagulant. What should the nurse include in the teaching plan? A. Discontinue the medication if you experience dizziness. B. Avoid foods high in vitamin K. C. Skip doses if you miss one. D. Anticoagulants are not needed for stroke prevention. Answer: B. Avoid foods high in vitamin K. Rationale: patients on anticoagulants should avoid excessive vitamin K intake, as it can interfere with the medication's effect. Dizziness, missed doses, and stopping the medication prematurely are not appropriate actions. 86. A nurse is caring for a patient recovering from a stroke. Which of the following is the best approach to assist the patient with activities of daily living, ADLs? A. Provide total assistance for all ADLs. B. Encourage as much independence as possible, providing assistance as needed. C. Do all activities for the patient to ensure they are completed safely. D. Wait until the patient requests assistance for ADLs. Answer: B. Encourage as much independence as possible, providing assistance as needed. Rationale: encouraging independence and providing support when necessary promotes recovery and self-esteem. Doing everything for the patient or waiting for them to request help can hinder their recovery. 87. A patient recovering from a stroke is being assessed for discharge. What is the most important factor to consider when planning for discharge? A. The patient's ability to resume previous activities immediately. B. The patient's level of independence with basic self-care tasks. C. The patient's desire to leave the hospital as soon as possible. D. The patient's ability to tolerate physical therapy. Answer: B. The patient's level of independence with basic self-care tasks. Rationale: the ability to perform basic self-care tasks independently is a key factor in discharge planning. While tolerance to therapy and desire to leave are important, Independence is the priority for safe discharge. 88. A stroke patient is at risk for aspiration. Which of the following interventions is appropriate to reduce this risk? A. Encourage the patient to swallow frequently during meals. B. Offer thickened liquids and soft foods only. C. Allow the patient to eat in a reclined position. D. To perform frequent suctioning to clear the airway. Answer. B. Offer thickened liquids and soft foods only. Rationale. Thickened liquids and soft foods are easier to swallow and reduce the risk of aspiration. Suctioning and frequent swallowing are not effective long-term solutions, and the patient should remain in an upright position during meals. 89. A patient who recently had a stroke is showing signs of hemianopia. What does this condition mean? A. The patient has complete loss of vision in one eye. B. The patient has partial loss of vision in both eyes. C. The patient has a loss of vision in half of the visual field in one or both eyes. D. The patient has difficulty with eye coordination. Answer. C. The patient has a loss of vision in half of the visual field in one or both eyes. Rationale. Hemianopia is the loss of vision in one half of the visual field in one or both eyes, often seen in patients after a stroke. The other options do not accurately describe hemianopia. 90. A stroke patient is being assessed for the ability to swallow. Which of the following assessments should be performed first? A. Ask the patient to swallow a small sip of water. B. Check the patient's gag reflex. C. Perform a bedside swallow assessment. D. Inspect the patient's mouth for food residue. Answer. C. Perform a bedside swallow assessment. Rationale. The bedside swallow assessment is the first step to evaluate the patient's ability to swallow. A gag reflex, mouth inspection, and offering food are part of the process but come after the initial assessment. 91. A patient is diagnosed with an ischemic stroke. Which of the following is the most common cause of this type of stroke? A. Ruptured aneurysm. B. Blockage in an artery supplying the brain. C. Bleeding in the brain. D. Heart attack. Answer. B. Blockage in an artery supplying the brain. Rationale. An ischemic stroke is most commonly caused by a blockage, thrombosis, or embolism in an artery supplying the brain. A ruptured aneurysm and brain bleeding are causes of hemorrhagic strokes, not ischemic. 92. A nurse is preparing to administer thrombolytics to a patient within the 3-hour window after stroke onset. Which of the following is a key consideration before administering this treatment? A. The patient's blood pressure is 120/80 mmHg. B. The patient's INR is within normal limits. C. A recent CT scan confirms a hemorrhagic stroke. D. The patient has a history of gastrointestinal bleeding. Answer. C. A recent CT scan confirms a hemorrhagic stroke. Rationale. Thrombolytics should not be administered if a hemorrhagic stroke is confirmed by CT scan, as this could worsen bleeding. A normal blood pressure and INR do not necessarily contraindicate thrombolytics, and gastrointestinal bleeding would be a concern for hemorrhagic stroke. 93. A patient is recovering from a stroke and has difficulty with speech. Which type of aphasia is most likely if the patient can understand speech but struggles to form words? A. Wernicke's aphasia. B. Broca's aphasia. C. Global aphasia. D. Anomic aphasia. Answer. B. Broca's aphasia. Rationale. Broca's aphasia is characterized by difficulty forming words but relatively intact comprehension. Wernicke's aphasia involves impaired comprehension. Global aphasia affects both comprehension and speech, and anomic aphasia involves difficulty naming objects. 94. A nurse is caring for a patient who has had a stroke and is showing signs of depression. What is the best intervention to support the patient? A. Encourage the patient to focus on physical recovery. B. Refer the patient for a psychiatric evaluation. C. Remind the patient of the progress they have made. D. Disregard the depression as part of the recovery process. Answer. B. Refer the patient for a psychiatric evaluation. Rationale. Depression is common after a stroke and can significantly impact recovery. Referral for a psychiatric evaluation ensures the patient receives appropriate care. Encouraging physical recovery or minimizing depression can delay proper management. 95. A stroke patient is being assessed for functional recovery. What is the priority outcome for rehabilitation in the first 24 to 48 hours? A. Regaining full mobility of the affected limbs. B. Preventing complications such as aspiration and pressure ulcers. C. Promoting independence with activities of daily living, ADLs. D. Enhancing cognitive function and memory. Answer. B. Preventing complications such as aspiration and pressure ulcers. Rationale. In the first 24 to 48 hours after stroke, preventing complications like aspiration and pressure ulcers is a priority. Full mobility, ADL independence, and cognitive function will be addressed in later stages of recovery. 96. A patient with a stroke is prescribed aspirin. What is the purpose of this medication in the stroke recovery plan? A. To prevent further bleeding in the brain. B. To lower blood pressure. C. To reduce the risk of another ischemic stroke. D. To improve blood flow to the brain. Answer. C. To reduce the risk of another ischemic stroke. Rationale. Aspirin is commonly used to reduce the risk of another ischemic stroke by preventing blood clots. It does not prevent bleeding or directly improve blood flow, nor does it specifically lower blood pressure. 97. A nurse is assessing a stroke patient for signs of increased intracranial pressure, ICP. Which of the following findings would be most concerning? A. A GCS score of 14. B. A decrease in pupil reaction to light. C. Blood pressure of 130/80 mmHg. D. Complaints of mild headache. Answer. B. A decrease in pupil reaction to light. Rationale. A decrease in pupil reaction to light is a sign of increased ICP, which is a medical emergency. A GCS score of 14 is still within normal limits, and mild headache and normal blood pressure are not immediate concerns for ICP. 98. A stroke patient is at risk for a fall due to weakness on one side of the body. What is the most effective intervention to prevent falls? A. Restrict the patient's movement and have them remain in bed. B. Provide a fall risk bracelet and allow the patient to move independently. C. Use a gait belt when assisting the patient with walking. D. Increase the patient's fluid intake to improve strength. Answer. C. Use a gait belt when assisting the patient with walking. Rationale. A gait belt provides support and stability when assisting a patient with walking, reducing the risk of falls. Restricting movement or relying on a bracelet is not as effective as using proper support when mobilizing the patient. 99. A patient is recovering from a stroke and has difficulty swallowing. Which of the following interventions is appropriate to prevent aspiration pneumonia? A. Administer fluids through a feeding tube. B. Have the patient lie flat while eating. C. Provide small, frequent meals with thickened liquids. D. Encourage the patient to chew gum after meals. Answer. C. Provides small, frequent meals with thickened liquids. Rationale. Small, frequent meals with thickened liquids are less likely to cause aspiration and are easier for patients with dysphagia to swallow. Lying flat and encouraging chewing gum would not prevent aspiration pneumonia. 100. A stroke patient develops left-sided hemiparesis. Which of the following interventions is most appropriate for promoting independence with mobility? A. Encourage the patient to use a wheelchair at all times. B. Provide full assistance with all movements. C. Encourage the patient to perform exercises to strengthen the affected side. D. Limit ambulation to prevent further weakness. Answer. C. Encourage the patient to perform exercises to strengthen the affected side. Rationale. Encouraging the patient to perform exercises to strengthen the affected side helps promote independence and mobility. Providing full assistance or limiting ambulation could hinder recovery. 101. A nurse is providing discharge teaching to a stroke patient. Which of the following should the nurse emphasize to reduce the risk of another stroke? A. Strict bed rest for 2 weeks after discharge. B. Taking prescribed medications as directed. C. Avoiding any form of physical activity. D. Discontinuing cholesterol-lowering medications once levels are normal. Answer. B. Taking prescribed medications as directed. Rationale. Adhering to prescribed medications is critical in reducing the risk of another stroke. Physical activity is generally encouraged within limitations, and medications should not be discontinued without medical guidance. 102. A nurse is preparing a care plan for a stroke patient who has developed a pressure ulcer. Which of the following interventions should be prioritized? A. Administer pain medications before repositioning. B. Limit patient movement to prevent further tissue damage. C. Reposition the patient every 2 hours to reduce pressure. D. Apply cold compresses to the ulcer site. Answer: C. Reposition the patient every 2 hours to reduce pressure. Rationale: repositioning every 2 hours helps relieve pressure and prevent further skin breakdown. Administering pain medication and limiting movement are secondary to repositioning. Cold compresses are not recommended for pressure ulcers. 103. A patient who recently had a stroke is experiencing urinary incontinence. What is the most appropriate intervention? A. Limit fluid intake to prevent urinary frequency. B. Encourage the patient to perform Kegel exercises. C. Use an indwelling catheter for long-term management. D. Implement scheduled toileting and incontinence care. Answer: D. Implement scheduled toileting and incontinence care. Rationale: scheduled toileting helps manage urinary incontinence and promotes bladder control. Kegel exercises may be helpful for strengthening pelvic muscles, but scheduled toileting is the primary intervention. 104. A patient with a stroke has been prescribed a medication to prevent blood clots. Which of the following medications is most commonly used for stroke prevention? A. Heparin. B. Warfarin. C. Aspirin. D. Dipyridamole. Answer: C. Aspirin. Rationale: aspirin is commonly used to reduce the risk of ischemic stroke by preventing blood clots. Heparin and warfarin are anticoagulants used in other situations, and dipyridamole is often used in combination with aspirin. 105. A nurse is educating a stroke patient about lifestyle modifications to reduce stroke risk. Which of the following should the nurse include in the teaching plan? A. Increase salt intake to improve circulation. B. Maintain a healthy weight and engage in regular exercise. C. Limit fluid intake to prevent high blood pressure. D. Avoid all dietary fats to reduce cholesterol levels. Answer: B. Maintain a healthy weight and engage in regular exercise. Rationale: maintaining a healthy weight and engaging in regular exercise are key lifestyle modifications to reduce stroke risk. Increasing salt intake or restricting fluids is not recommended, and dietary fats should be moderated, not eliminated entirely. 106. A patient is exhibiting signs of dysphagia after a stroke. Which of the following interventions should be implemented first? A. Provide thickened liquids and soft foods. B. Initiate speech therapy evaluation. C. Administer oral medications with water. D. Offer high-calorie nutritional supplements. Answer: B. Initiate speech therapy evaluation. Rationale: the first step in addressing dysphagia is to initiate a speech therapy evaluation to assess the patient's swallowing function and determine the appropriate interventions. Providing thickened liquids and soft foods can follow after the evaluation. 107. Which of the following interventions is most appropriate for a stroke patient with aphasia? A. Speak loudly and slowly. B. Use nonverbal communication methods, such as gestures. C. Avoid all conversations to reduce frustration. D. Encourage the patient to write as much as possible. Answer: B. Use nonverbal communication methods, such as gestures. Rationale: for patients with aphasia, nonverbal communication, such as gestures or pictures, is essential for understanding. Speaking loudly is not effective, and avoiding conversations would limit communication, further isolating the patient. Writing may also be difficult for the patient depending on the type of aphasia. 108. A nurse is caring for a stroke patient who has a history of hypertension. Which of the following interventions is most crucial in preventing further strokes? A. Administer antihypertensive medication as prescribed. B. Monitor the patient's glucose levels regularly. C. Encourage the patient to increase sodium intake. D. Ensure the patient has adequate bed rest for several days. Answer: A. Administer antihypertensive medication as prescribed. Rationale: controlling hypertension is a key factor in preventing future strokes. Regular glucose monitoring is important for diabetic patients, but hypertension management is the priority in this scenario. Bed rest is not necessary if the patient is stable, and sodium intake should be restricted. 109. Which of the following is a potential complication of a hemorrhagic stroke? A. Deep vein thrombosis. B. Increased intracranial pressure. C. Hemiplegia. D. Renal failure. Answer: B. Increased intracranial pressure. Rationale: increased intracranial pressure, ICP, is a common complication of hemorrhagic strokes due to bleeding within the brain. Hemiplegia can occur with both ischemic and hemorrhagic strokes, but ICP is specific to hemorrhagic stroke. 110. A patient has been admitted with an ischemic stroke. Which of the following is a primary treatment goal within the first 3 hours of onset? A. Control blood pressure. B. Administer intravenous thrombolytics. C. Prevent further hemorrhage. D. Administer aspirin to reduce clot formation. Answer: B. Administer intravenous thrombolytics. Rationale: thrombolytic therapy, such as tissue plasminogen activator, TPA, is the primary treatment goal within 3 hours of an ischemic stroke to dissolve the clot and restore blood flow. Blood pressure control is important, but secondary to thrombolysis. 111. A nurse is monitoring a stroke patient who has been started on anticoagulation therapy. Which of the following findings would indicate a potential complication? A. Slight headache. B. Blood in the urine. C. Increased appetite. D. Increased energy levels. Answer: B. Blood in the urine. Rationale: blood in the urine is a sign of potential bleeding, a serious complication of anticoagulation therapy. Headache could be due to other causes, while increased appetite and energy levels are not indicators of anticoagulant complications. 112. A nurse is educating a patient with a history of stroke on lifestyle modifications to reduce stroke risk. Which of the following should the nurse recommend? A. Increase intake of trans fats. B. Engage in regular physical activity. C. Limit the intake of fruits and vegetables. D. Increase alcohol consumption to reduce stress. Answer: B. Engage in regular physical activity. Rationale: regular physical activity is essential for reducing stroke risk by controlling blood pressure, cholesterol, and weight. Trans fats should be avoided, and a balanced diet with fruits and vegetables should be encouraged. Alcohol consumption should be limited. 113. A nurse is caring for a stroke patient who is experiencing hemianopia. What should be the primary nursing intervention? A. Teach the patient to scan the visual field. B. Encourage the patient to wear corrective glasses. C. Provide a large print book for reading. D. Position the patient's bed with the unaffected side facing the room door. Answer: A. Teach the patient to scan the visual field. Rationale: teaching the patient to scan the visual field helps compensate for the loss of vision in one half of the visual field. Glasses may help with other vision problems, but scanning is more effective for hemianopia. 114. A nurse is assessing a stroke patient for signs of cognitive changes. Which of the following is a common cognitive change seen after a stroke? A. Impaired memory. B. Increased socialization. C. Enhanced concentration. D. Improved problem-solving skills. Answer: A. Impaired memory. Rationale: memory impairment is a common cognitive change after a stroke, particularly with damage to areas of the brain responsible for memory. Stroke patients may experience difficulty with concentration, problem-solving, and socialization. 115. A nurse is educating a stroke patient on managing risk factors for a second stroke. Which of the following should the nurse emphasize? A. Stop taking prescribed medications once symptoms improve. B. Maintain a low-fat, low-sodium diet. C. Increase physical activity to twice a week. D. Avoid any medication for blood pressure control. Answer: B. Maintain a low-fat, low-sodium diet. Rationale: a low-fat, low-sodium diet helps manage blood pressure, cholesterol, and weight, all important factors in preventing a second stroke. Medication adherence is essential, and physical activity should be more frequent than twice a week. 116. A patient with a stroke is being assessed for depression. Which of the following is a common sign of depression after a stroke? A. Euphoria and excessive talkativeness. B. Difficulty concentrating and a lack of interest in activities. C. Rapid speech and hyperactivity. D. Increased energy and excessive social interaction. Answer: B. Difficulty concentrating and a lack of interest in activities. Rationale: depression after a stroke often manifests as difficulty concentrating, apathy, and loss of interest in activities. Euphoria, rapid speech, hyperactivity, and excessive social interaction are not typical symptoms of depression. 117. A nurse is educating a stroke patient on the importance of rehabilitation. Which of the following goals should the nurse emphasize for stroke rehabilitation? A. Regaining full physical mobility within the first 24 hours. B. Learning adaptive strategies for daily activities. C. Expecting immediate return to normal cognitive function. D. Focusing primarily on speech therapy for recovery. Answer: B. Learning adaptive strategies for daily activities. Rationale: stroke rehabilitation focuses on helping patients regain function and independence, often through adaptive strategies. Full physical mobility and immediate return to cognitive function are not realistic in the early stages of recovery. 118. A nurse is caring for a stroke patient with hemiparesis. Which of the following interventions is most appropriate to promote independence with activities of daily living? A. Perform all daily tasks for the patient to reduce fatigue. B. Assist with the use of assistive devices to improve function. C. Encourage the patient to avoid any physical activity. D. Restrict the patient's movement to avoid falls. Answer: B. Assist with the use of assistive devices to improve function. Rationale: using assistive devices, such as walkers or reachers, helps promote independence in performing daily tasks for a patient with hemiparesis. Performing tasks for the patient or restricting movement is not conducive to recovery. 119. A nurse is providing discharge teaching to a stroke patient who is at risk for another stroke. Which of the following actions should the nurse recommend? A. Avoid using any form of blood pressure medication. B. Stop taking statins once cholesterol levels normalize. C. Continue taking prescribed medications and attend follow-up appointments. D. Restrict fluid intake to prevent further strokes. Answer: C. Continue taking prescribed medications and attend follow-up appointments. Rationale: continuing medications and attending follow-up appointments are essential for stroke prevention and managing risk factors. Stopping blood pressure medications or statins prematurely can increase the risk of another stroke. 120. A patient is diagnosed with a transient ischemic attack, TIA. Which of the following is an important aspect of management for this patient? A. Immediate administration of thrombolytics. B. Long-term anticoagulation therapy. C. Monitoring for stroke-like symptoms and preventing recurrence. D. Restricting the patient's movement to prevent another TIA. Answer: C. Monitoring for stroke-like symptoms and preventing recurrence. Rationale: TIAs are often considered a warning sign of a potential stroke. Monitoring for recurrence and addressing risk factors for stroke prevention are key. Thrombolytics are not used for TIAs, and long-term anticoagulation is not always necessary. 121. A stroke patient is experiencing dysarthria. Which of the following interventions should the nurse prioritize? A. Provide a communication board for the patient. B. Encourage the patient to speak loudly. C. Restrict the patient's fluid intake to prevent aspiration. D. Assist with the use of a walking aid. Answer: A. Provide a communication board for the patient. Answer: A. Provide a communication board for the patient. Rationale: dysarthria is difficulty with speech due to motor control issues. A communication board can help the patient communicate effectively. Speaking loudly is not helpful, and fluid restriction is not related to dysarthria. A walking aid is unrelated to speech issues. 122. A nurse is assessing a patient with a stroke who is experiencing hemiparesis. Which of the following is the best intervention to promote safety while ambulating? A. Encourage the patient to walk independently. B. Use a gait belt to assist with walking. C. Provide the patient with a cane to increase mobility. D. Keep the patient in bed to prevent falls. Answer: B. Use a gait belt to assist with walking. Rationale: a gait belt provides stability and support when assisting a patient with hemiparesis to walk, reducing the risk of falls. Encouraging independent walking or providing a cane might be unsafe if the patient is not yet stable. Keeping the patient in bed is not ideal for recovery. 123. A stroke patient is exhibiting signs of a deep vein thrombosis, DVT. What is the priority intervention? A. Administer anticoagulant therapy as prescribed. B. Apply warm compresses to the affected area. C. Restrict the patient's movement to reduce strain. D. Encourage the patient to elevate the affected limb. Answer. A. Administer anticoagulant therapy as prescribed. Rationale. Anticoagulant therapy is the primary treatment for DVT to prevent clot progression and pulmonary embolism. Warm compresses and limb elevation can provide comfort, but anticoagulation is the most important intervention. 124. A patient who has had a stroke is experiencing difficulty with balance and coordination. Which of the following therapies is most appropriate to address these issues? A. Physical therapy. B. Speech therapy.
C. Occupational therapy.
D. Respiratory therapy. Answer. A. Physical therapy. Rationale. Physical therapy is essential for improving balance and coordination following a stroke. Speech therapy addresses communication issues. Occupational therapy helps with activities of daily living, and respiratory therapy is used for breathing problems, not balance. 125. A nurse is caring for a patient who had a stroke and is receiving intravenous thrombolytic therapy. Which of the following assessments is most important during this therapy? A. Monitor the patient's blood pressure. B. Assess for signs of increased intracranial pressure. C. Monitor the patient's level of consciousness. D. Check the patient's serum potassium level. Answer. B. Assess for signs of increased intracranial pressure. Rationale. Thrombolytic therapy increases the risk of bleeding, which can lead to increased intracranial pressure. Monitoring for ICP is essential. While blood pressure and consciousness are important, ICP is the most critical in this scenario. 126. A nurse is educating a stroke patient about the risk of a second stroke. Which of the following statements by the patient indicates understanding of the teaching? A. I should stop taking my blood pressure medication when my blood pressure is normal. B. I need to continue taking my cholesterol medication even if my cholesterol is normal. C. I can resume smoking once my stroke symptoms improve. D. I should limit my exercise to avoid increasing my blood pressure. Answer. B. I need to continue taking my cholesterol medication even if my cholesterol is normal. Rationale. Stroke patients should continue taking prescribed medications, such as cholesterol-lowering drugs, even if their levels improve. Stopping medications can increase the risk of another stroke. Smoking and limiting exercise are also risk factors for stroke. 127. A patient who had a stroke is receiving rehabilitation therapy. Which of the following interventions should the nurse implement to promote functional independence? A. Perform all daily tasks for the patient. B. Encourage the patient to perform activities independently, with assistance as needed. C. Provide a sedative to reduce anxiety during therapy. D. Encourage the patient to avoid participating in therapy sessions. Answer. B. Encourage the patient to perform activities independently, with assistance as needed. Rationale. Encouraging the patient to perform activities independently with assistance promotes functional independence and recovery. Performing tasks for the patient or avoiding therapy would hinder recovery. 128. A nurse is assessing a stroke patient for signs of a seizure. Which of the following findings is most indicative of a seizure? A. Unilateral weakness. B. Involuntary muscle jerking or twitching. C. Slurred speech and difficulty finding words. D. Hemianopia and impaired vision. Answer. B. Involuntary muscle jerking or twitching. Rationale. Involuntary muscle jerking or twitching is a classic sign of a seizure. Unilateral weakness and slurred speech are common after a stroke, and hemianopia affects vision, not motor function. 129. A nurse is caring for a stroke patient who is experiencing a sudden loss of speech. Which of the following interventions is most appropriate? A. Encourage the patient to speak louder. B. Notify the healthcare provider immediately. C. Encourage the patient to rest and try again later. D. Use a communication board for the patient to point to. Answer. B. Notify the healthcare provider immediately. Rationale. A sudden loss of speech could indicate a worsening stroke or another issue requiring immediate medical attention. Using a communication board is helpful, but notifying the healthcare provider is the priority. 130. A stroke patient develops dysphagia. What is the best nursing intervention to prevent aspiration? A. Position the patient with the head of the bed flat. B. Offer liquids and foods that are thin and watery. C. Offer thickened liquids and soft foods. D. Encourage the patient to eat large meals. Answer: C. Offer thickened liquids and soft foods. Rationale: thickened liquids and soft foods reduce the risk of aspiration in stroke patients with dysphagia. Flat positioning and offering thin liquids can increase the risk of aspiration. Large meals should also be avoided. 131. A nurse is caring for a stroke patient who is at risk for falls. Which of the following actions should the nurse take to reduce fall risk? A. Restrict the patient's movement to prevent falls. B. Place a fall risk alert bracelet on the patient. C. Allow the patient to move independently at all times. D. Keep the bed in a high position to encourage patient mobility. Answer: B. Place a fall risk alert bracelet on the patient. Rationale: a fall risk alert bracelet helps notify staff of the patient's risk and ensures appropriate precautions are taken. Restricting movement or allowing independent movement can increase fall risk. The bed should be kept in a low position for safety. 132. A stroke patient is experiencing a decreased level of consciousness. What is the priority nursing intervention? A. Administer a sedative to help the patient rest. B. Position the patient to maintain airway patency. C. Increase the patient's fluid intake. D. Provide a quiet environment to reduce stimulation. Answer: B. Position the patient to maintain airway patency. Rationale: maintaining airway patency is the priority when there is a decreased level of consciousness. Sedatives, fluids, and a quiet environment may be appropriate later, but airway management is the top priority. 133. A stroke patient is having difficulty with emotional control, exhibiting frequent laughing or crying without cause. Which of the following is the most likely cause of this behavior? A. Emotional lability. B. Depression. C. Dementia. D. Anxiety. Answer: A. Emotional lability. Rationale: emotional lability, or uncontrollable laughing or crying, is a common post-stroke behavior due to disruption in brain areas that control emotions. Depression, dementia, and anxiety can also cause mood changes, but emotional lability is specific to stroke-related brain damage. 134. A nurse is caring for a stroke patient who is on aspirin therapy. Which of the following should be a priority nursing assessment? A. Monitoring the patient's blood pressure. B. Assessing the patient for signs of bleeding. C. Checking the patient's blood glucose level. D. Monitoring the patient's urine output. Answer: B. Assessing the patient for signs of bleeding. Rationale: aspirin is an anticoagulant and increases the risk of bleeding. Therefore, the nurse should closely monitor the patient for signs of bleeding, such as bruising, hematuria, or gastrointestinal bleeding. 135. A nurse is caring for a stroke patient with right-sided weakness. Which of the following should the nurse focus on to promote functional independence? A. Encourage the patient to use their left hand for all tasks. B. Assist the patient in practicing motor skills with their right hand. C. Provide full assistance for all activities of daily living. D. Restrict the patient from using the right hand for safety. Answer: B. Assist the patient in practicing motor skills with their right hand. Rationale: assisting the patient in practicing motor skills with the affected hand, right hand, helps promote recovery of function and independence. Encouraging the use of the unaffected hand limits recovery of the affected side. 136. A nurse is caring for a stroke patient who is showing signs of neglect. Which of the following actions should the nurse take to ensure the patient's safety? A. Encourage the patient to focus on the neglected side. B. Ignore the neglected side and focus on the unaffected side. C. Position the patient so that the neglected side is less visible. D. Avoid assisting the patient in compensating for the neglect. Answer: A. Encourage the patient to focus on the neglected side. Rationale: encouraging the patient to focus on the neglected side helps improve awareness and reduce the risk of injury. Ignoring or avoiding the neglected side will reinforce the neglect. 137. A stroke patient is experiencing urinary incontinence. Which of the following interventions is most appropriate? A. Insert a Foley catheter for long-term management. B. Implement scheduled toileting to promote bladder control. C. Limit the patient's fluid intake to reduce urinary frequency. D. Discourage the patient from participating in toileting activities. Answer. B. Implement scheduled toileting to promote bladder control. Rationale. Scheduled toileting promotes bladder control and helps manage incontinence. Inserting a Foley catheter, limiting fluid intake, and discouraging participation in toileting activities are not recommended for long-term management. 138. A stroke patient is experiencing visual neglect. Which of the following interventions should the nurse implement to promote safety? A. Encourage the patient to use their unaffected eye only. B. Position objects on the unaffected side to encourage use of both sides. C. Encourage the patient to only look to the unaffected side. D. Ensure the patient is in a dark room to reduce stimulation. Answer. B. Position objects on the unaffected side to encourage use of both sides. Rationale. Positioning objects on the neglected side encourages the patient to use that side and helps to reduce neglect. Ignoring or restricting the use of the affected side, unaffected eye only, or limiting visual input is not helpful. Ensuring the patient is in a dark room is counterproductive. 139. A stroke patient is receiving antiplatelet therapy. Which of the following should be a priority nursing assessment? A. Monitor for signs of bleeding. B. Assess for signs of infection. C. Evaluate the patient's level of consciousness. D. Check the patient's temperature regularly. Answer. A. Monitor for signs of bleeding. Rationale. Antiplatelet therapy increases the risk of bleeding, so the nurse must monitor for signs such as bruising, hematuria, or gastrointestinal bleeding. Infection and changes in consciousness are important but less directly related to antiplatelet therapy. 140. A nurse is caring for a patient with a history of stroke. Which of the following statements by the patient indicates an understanding of stroke prevention? A. I should continue smoking to reduce stress. B. I need to avoid exercising to prevent raising my blood pressure. C. I will take my medications as prescribed, even when I feel fine. D. I will only monitor my blood pressure when I feel dizzy. Answer. C. I will take my medications as prescribed, even when I feel fine. Rationale. Consistent medication adherence is essential for stroke prevention, even when the patient feels well. Smoking and avoiding exercise increase stroke risk, and blood pressure should be monitored regularly, not just when feeling symptoms. 141. A nurse is assessing a stroke patient who has been experiencing worsening confusion. Which of the following is the most likely cause of this change in mental status? A. Hypoglycemia. B. Increased intracranial pressure. C. Dehydration. D. Anxiety. Answer. B. Increased intracranial pressure. Rationale. Worsening confusion can be a sign of increased intracranial pressure, ICP, which may occur due to brain swelling or bleeding after a stroke. Hypoglycemia, dehydration, and anxiety may contribute to confusion but are less likely to be the primary cause. 142. A stroke patient is experiencing facial drooping on the right side. Which of the following interventions should the nurse implement? A. Encourage the patient to speak more clearly. B. Perform passive range of motion exercises on the left side of the face. C. Provide the patient with a facial prosthesis. D. Assist the patient in using a straw for drinking liquids. Answer. B. Perform passive range of motion exercises on the left side of the face. Rationale. Facial drooping often occurs due to muscle weakness on one side. Passive range of motion exercises help prevent further muscle atrophy. Encouraging clear speech or using a straw is not directly related to facial drooping. 143. A stroke patient is being discharged with a prescription for warfarin. Which of the following should the nurse include in discharge teaching? A. You should avoid all physical activity to prevent injury. B. You need to monitor for signs of bleeding, such as bruising or nosebleeds. C. You can take over-the-counter aspirin as needed for pain relief. D. You should drink alcohol regularly to help prevent another stroke. Answer. B. You need to monitor for signs of bleeding, such as bruising or nosebleeds. Rationale: warfarin is an anticoagulant that increases the risk of bleeding, so the patient should monitor for signs of bleeding. Avoiding physical activity, taking aspirin, or drinking alcohol are not recommended while on warfarin. 144. A nurse is caring for a patient who is experiencing expressive aphasia after a stroke. Which of the following is the most effective communication strategy? A. Speak louder to the patient. B. Encourage the patient to write down their thoughts. C. Ask yes or no questions to the patient. D. Provide a communication board for the patient to point to. Answer: C. Ask yes or no questions to the patient. Rationale: asking yes or no questions helps the patient communicate when they have difficulty expressing themselves verbally. Encouraging writing or using a communication board may also help, but yes or no questions are often more effective in the initial stages. 145. A nurse is caring for a stroke patient with a low GCS score. What is the priority nursing intervention? A. Administer sedatives to calm the patient. B. Maintain airway patency and support breathing. C. Restrict the patient's movement to prevent falls. D. Provide a calm and quiet environment. Answer: B. Maintain airway patency and support breathing. Rationale: in a patient with a low GCS score, airway management and supportive breathing are the top priorities. Sedatives, movement restrictions, and environmental control come after addressing basic life support needs. 146. A nurse is educating a stroke patient about the importance of adhering to physical therapy. Which of the following should the nurse emphasize? A. Physical therapy will only help with motor recovery. B. Skipping therapy sessions occasionally will not affect recovery. C. Therapy should be continued even after noticeable improvements. D. It is best to rest during recovery and avoid excessive physical activity. Answer: C. Therapy should be continued even after noticeable improvements. Rationale: continued participation in therapy helps ensure full functional recovery and prevents setbacks even after noticeable improvements. Skipping sessions or resting too much can hinder progress. 147. A nurse is assessing a stroke patient's ability to swallow. Which of the following is the most appropriate action to prevent aspiration? A. Place the patient in a supine position during meals. B. Provide thin liquids to the patient. C. Offer thickened liquids and soft foods. D. Encourage the patient to eat quickly to reduce meal duration. Answer: C. Offer thickened liquids and soft foods. Rationale: thickened liquids and soft foods reduce the risk of aspiration in stroke patients with dysphagia. The patient should be placed in an upright position during meals to aid swallowing and reduce aspiration risk. 148. A stroke patient is showing signs of visual neglect. Which of the following interventions should the nurse implement to promote safety? A. Encourage the patient to use their unaffected eye only. B. Position objects on the unaffected side to encourage use of both sides. C. Encourage the patient to only look to the unaffected side. D. Ensure the patient is in a dark room to reduce stimulation. Answer: B. Position objects on the unaffected side to encourage use of both sides. Rationale: positioning objects on the neglected side can help the patient become more aware of that side and reduce the risk of injury. Ignoring the neglected side or limiting visual input is not helpful. 149. A nurse is caring for a patient who has had a stroke and is experiencing incontinence. Which of the following should be included in the plan of care? A. Restrict fluid intake to reduce the need to urinate. B. Use incontinence pads for long-term management. C. Implement a toileting schedule to encourage bladder control. D. Avoid any discussion about incontinence to prevent embarrassment. Answer: C. Implement a toileting schedule to encourage bladder control. Rationale: a toileting schedule helps promote bladder control and prevent incontinence. Restricting fluid intake or using pads without addressing the cause of incontinence is not a long-term solution. 150. A stroke patient is being discharged and will require long-term rehabilitation. Which of the following is a key aspect of discharge planning? A. Ensure that the patient has access to transportation for therapy sessions. B. Provide the patient with a list of exercise routines to follow independently. C. Advise the patient to discontinue medications once they feel better. D. Recommend the patient avoid therapy sessions after the first few weeks. Answer: A. Ensure that the patient has access to transportation for therapy sessions. Rationale: ensuring transportation to therapy sessions is crucial for continued rehabilitation. Discontinuing medications or avoiding therapy would hinder recovery.